All right, everybody, welcome back. Ready for another deep dive?
Always ready.
Okay, great. Well, today we're tackling Wegovy,
Mm-hmm.
this weight loss drug that's been
Yeah.
making headlines, and it seems like everyone's talking about it these
Yeah,
days,
it's really taken off.
especially for older adults.
Right.
And to help us navigate this topic,
Yeah.
we're going to be looking at a report from
Mm-hmm.
the National Initiative for Care of the Elderly up in Canada.
Oh, excellent source.
Yeah, so we're getting into some serious stuff here.
Yeah, it's really important.
And I think the first question on a lot of people's minds is, how is this different
Yeah.
from all the other weight loss solutions that are already out there?
Well, the interesting thing about Wegovy is that it's actually
Right.
a higher dose version of a drug you might already be familiar with, Ozempic.
Ozempic, right, for diabetes?
Exactly.
Okay.
So Ozempic is used to treat type 2 diabetes,
Mm.
and it uses the same active ingredient
Huh?
called semaglutide, but Wegovy just has a higher dose of it.
So it's like Ozempic's,
Yeah,
like,
yeah,
super sibling.
exactly. It's like Ozempic on steroids, right?
Okay, interesting. And that's what
Yeah.
gives it that stronger effect on
Yeah,
appetite suppression.
exactly. And it's really interesting because
Uh,
the clinical trials that they've done with Wegovy
yeah,
show that it's not just about losing weight.
okay.
There's other health benefits too.
Interesting.
Like they've seen improvements in blood pressure,
Wow.
blood sugar levels,
Okay.
cholesterol levels.
So it could actually end up being kind of a
Ab-
game changer for folks that are
Yeah,
dealing with weight-related conditions.
absolutely. Because we know that being
Fine.
overweight or obese
Mm.
can contribute to things like diabetes, heart disease,
Right.
even sleep apnea.
Yeah. And
So this
man,
is really promising.
so how does it actually work, though?
Okay.
Like, is it a magic bullet?
No, I mean, there's no such thing as a magic bullet,
Yeah.
but it is pretty cool the way it works.
Good.
So Wegovy mimics
Mhm.
a hormone that we have naturally in our bodies called GLP-1,
Mm-hmm.
and this hormone basically regulates your appetite
Okay.
and how quickly your body digests food.
Okay.
So by taking Wegovy, it's
Yeah.
like you're boosting those signals in your body
Interesting.
that tell you to feel full,
Okay.
and it slows down the digestive process so you're not as hungry.
That makes sense.
Yeah.
I mean, if you're already feeling full, you're not going to
Right.
reach for that second helping.
Exactly. And not only that, there's some research suggesting that it might actually change your food preferences.
Oh, wow.
So you might actually find yourself craving those calorie-dense foods less.
Okay.
So it's not just about,
Yeah.
reducing your appetite, but also kind of shifting your taste buds a little bit.
So, like, instead of craving a bag of chips, maybe you crave
Yeah.
like a salad or something.
Yeah, maybe you're like, oh, I really want some broccoli right now.
That would be pretty amazing.
That would be a game changer.
Right. Yeah, totally.
I mean, I'm sure a lot of people would be happy about that.
Yeah. Okay. So,
Okay.
I mean, this all sounds really great, but
Mhm.
are there certain requirements
Yeah,
someone needs to meet in order to get a prescription for this in Canada?
absolutely. It's not just for anybody.
Oh, okay.
So to qualify for Wegovy in Canada, you need to have a BMI
Okay.
of 27 or higher
Yeah.
and at least one weight-related condition.
Okay.
Like the ones we talked about before, diabetes, heart disease, sleep apnea.
And I think they gave a really great example in this report too, didn't they?
Yeah, they did.
It said something like a man who's 5'11"
Yeah.
and weighs about 200 pounds
hmm
would qualify if he had one of those conditions.
Exactly. So it
Yeah.
gives you kind of a concrete example
Right. Okay. So
to help people understand.
so
now.
it is for people that really
Yeah.
are struggling with their weight.
Yeah. It's not just for someone who wants to lose a few pounds
Okay.
before, summer vacation or something like that.
Right. It's really for
Yeah.
people that need to make a change
Right.
for their overall health and well-being.
Absolutely. And one thing that's really important to emphasize is that
Mm.
Wegovy is meant to be used alongside lifestyle changes.
Okay.
So it's not just like you take this medication
Right.
and you can continue eating whatever you want
Right.
and not exercising. It's really meant to work in conjunction with a healthy diet
Mm.
and regular physical activity.
So it's like a
Yeah.
tool in your tool
Yeah.
belt, but it's not the only tool.
Exactly. It's not a magic bullet.
Gotcha. Okay. Then that makes a lot of sense.
Yeah.
And so let's talk about the main focus of this deep dive,
Right.
which is older adults.
Okay.
What are some things that
Yeah.
older adults need to keep in mind
Yeah.
if they're thinking about maybe going on Wegovy?
Well, this is really where we get into some important consideration.
Okay.
Because while Wegovy shows a lot of promise,
Mhm.
we're still learning about its long-term effects on older adults.
So we're sort of venturing into uncharted territory here.
Yeah, a little bit.
Okay.
I mean, there's still research ongoing to fully understand
Yeah.
how it affects this population specifically.
Yeah.
And one of the concerns is that Wegovy can cause weight loss to happen quite rapidly.
Okay.
And while that might sound appealing to some people,
Right.
it can actually be risky,
Okay.
especially for older adults.
In what way?
Well, when you lose weight quickly, you're not just losing fat,
Right.
you're also losing muscle mass.
Okay.
And losing muscle mass can be a real problem for seniors.
Why is that?
Well, for a couple of reasons. First of all,
Mm-hmm.
it increases their risk of falls.
Right.
And as we know, falls can be really dangerous for older people.
Right, because that can lead to broken bones and
Exactly.
the
That's really
complication.
good.
They can lose their mobility. They might need to go into a nursing home.
Right.
It can really impact their quality of life.
So that's yeah.
To be mindful of.
Absolutely.
Okay.
And another thing to consider is that older adults often take multiple medications,
Right.
and that can increase their chances of experiencing side effects from Wegovy.
Okay.
And they're more susceptible
Yeah.
to certain side effects, especially gastrointestinal side effects like nausea, vomiting, diarrhea.
And that's, I guess, what they were talking about in the report when they were saying
Right.
that seniors might have more intense stomach-related side effects than younger folks.
And that's why it's really important for them to pay attention to their nutrition and hydration
Okay.
to make sure they're staying well hydrated
Yeah.
and getting the nutrients they need.
So it sounds like it's really important for seniors who are considering Wegovy
Absolutely.
to work closely with your doctor
Absolutely.
to monitor their progress and
Yeah.
make sure everything's going okay.
Exactly. They need to be closely monitored by their healthcare provider
Yeah.
to manage any potential side effects.
Right.
Okay, so really, what we're seeing here is that Wegovy is a powerful tool,
Yes.
but it's not a one-size-fits-all solution.
Yes, exactly.
Especially for older adults.
It's really important to remember that everyone's different.
Right.
What works for one person might not work for another.
Right. And that's why talking to your doctor is so important.
Exactly.
Before making any decisions.
It can help you.
About your health or
Yeah.
taking any new medications.
Assess your individual situation.
Mm-hmm.
Take into account your medical history, your current medications,
Yeah.
and really tailor a plan that's safe and effective for you.
Right. And I guess that's what's so great about having a doctor is that they can
Absolutely.
really personalize your approach.
Yeah, it's not a one-size-fits-all approach.
Yeah.
It's about individualized care
Right.
and finding what works best for each person.
Well said. I think that's a great place to kind of
Yeah.
wrap things up. But
Yeah.
before we go, I want to leave our listeners with something to think about.
Okay.
We've talked a lot about the potential benefits and risks of Wegovy
Right.
and how those might be different for older adults compared to younger people.
Right.
But I'm curious to hear what you all think.
Yeah.
How do you think the potential benefits and risks of Wegovy should be weighed differently
Yeah.
for older adults?
Yeah, that's a really important question.
Right.
And it's something that individuals need to discuss with their healthcare providers.
Right.
But it's also something that we as a society need to be thinking about.
Right.
As this medication becomes more widely available,
Yeah.
we need to be having these conversations
Right.
about how to use it responsibly
Right. And how to
and ethically.
make sure that it's being used in a way that's going to benefit everyone.
Exactly.
Yeah. Okay.
Right.
Well, that's a great question to ponder.
Yeah.
And for those who want to learn more about this,
Mm-hmm.
we highly recommend checking out
Yeah.
the National Initiative for Care of the Elderly website.
They have a ton of great resources
They do.
on their website.
So definitely head over there and check it out. And thank you, everyone, for joining us on another deep dive.
Yeah, thanks for listening, everybody.
See you next time.
See you later. Perez here.